This micro-credential deals with promoting workplace health and has 3 targeted skills. This targeted skill addresses workplace ergonomics. Ergonomics is one of the important components of workplace safety. It's the science of fitting the job to the worker rather than fitting the worker to the job. A company data log on injuries and illness is an important way to identify current and potential ergonomic problems, along with reviewing jobs with the highest injury rates. Another method is to conduct a walk-around inspection to observe how employees are performing. Risk factors are those that increase the chance of injury. The main concern is for development of musculoskeletal disorders, or MSDs. These are soft tissue injuries of the muscles, nerves, tendons, joints, and cartilage in the upper and lower limbs, neck, and lower back. MSDs are caused by sudden or sustained exposure to repetitive motion, force, vibration, and awkward positioning. For ergonomic injuries such as MSDs, some risk factors are awkward postures, motion repetition, excessive force, static posture, vibrations, poorly designed or fitted tools, extreme temperatures, and lack of work organization. Awkward postures include any posture that's not a comfortable, neutral position, especially if working overhead or in a lower position like kneeling, twisting, or bending. Exerting excessive force for lifting, pushing, or pulling heavy objects use postures that may be damaging. If a person spends many hours at a computer or desk, he or she is in a static posture. Working with a bent wrist can become painful. Repeating the same motion over time will stress muscles and joints in the back and wrist. Workers who spend a lot of time at a computer station should use a height adjustable chair with the keyboard at elbow level. Environmental conditions can put workers at risk. When temperature is extremely hot or cold, it can affect blood flow to the extremities and cause numbness and a poor grip. Tools should be sized and designed to fit the worker's grip. Another factor that can lead to injury is poor work organizations, such as unrealistic schedule with not enough workers or rest breaks. The goal of ergonomics is to prevent MSDs, the soft tissue injuries and musculoskeletal disorders caused by sudden or sustained exposure to occupational risks, such as forces, vibrations, repetitive motion, and awkward postures. Most occupational clusters have ergonomic guidelines to instruct workers how to lift and perform other job functions safely to prevent MSDs. There are ways to decrease the risk of heavy lifting. Materials should be delivered close to the place where work is to be done to avoid lifting and moving heavy items. Use adjustable platforms to bring packages to waist level before lifting heavy objects, or have 2 workers work together to lift a heavier package. Proper height adjustment of the computer chair and placement of the mouse and mousepad can help relieve back or wrist pain. The computer chair should follow the spinal curve. The keyboard and mouse must be close to the body and within reach. Look away from the computer screen about every 20 minutes to avoid eye strain. If a worker spends a lot of time on the phone, use a headset. Many larger organizations may have people who can assess the workstation and suggest adjustments. In conclusion, poor ergonomics are a main source of workplace injury, especially MSDs. Knowing the risk factors and how to perform a job to avoid injuries are the 2 main preventative strategies to keep employees working without pain.